Dr. Mohammed Hidayat Greenfield, and I'm the elected regional secretary of the IUF in the Asia Pacific region. The IUF is an international trade union organization representing 10 million workers in 127 countries around the world. Our membership is made up of workers in farms, plantations, agriculture, food processing, beverage manufacturing, hotels, restaurants, catering, and tourism. We'd like to talk today about COVID-19 as an occupational disease. On April 28, the International Workers' Memorial Day is a day to remember workers who are killed or injured at work. And the slogan we have for April 28 is "Remember the dead, fight for the living." Now, it's very important that April 28 was the day in which we and other trade unions pushed very hard for recognition of COVID-19 as an occupational disease. So what does this mean? The challenge is that in the last couple of months, most employers have responded to COVID-19 as a public health risk, a pandemic that has encroached the workplace, and therefore employers have responded with certain measures recommended by the WHO to try to keep out that risk. Whereas in fact, the reality is many workers have contracted COVID-19, the disease, in the workplace. It is exposure to the biological agent, in this case, the coronavirus SARS-CoV-2, that gave the workers this disease, COVID-19. And so it is very much a disease where we face risk in the workplace. Now, the workplace is interesting because the workplace we're talking about is not just the farm, factory, or hotel. According to international definitions of the workplace, it includes traveling to and from work and any travel that you need to do because of work. So if we take the International Labour Convention number 155 on occupational health and safety, let's look at the definition of a workplace. The term workplace covers all places where workers need to be or to go by reason of their work, and which are under the direct or indirect control of the employer. So not just the direct control of the employer in the workplace, but the indirect control as well. So what this means is, as long as there is a potential risk of being infected with COVID-19 in the workplace, that workplace includes when you're traveling to and from work, where there could be, in areas where there's an outbreak of COVID-19, a very high risk. But it is the employer's responsibility to ensure that transportation is also safe. If the employer is unable to guarantee safety in your travel and to and from work, then workers have a right to remain at home. By remaining at home, we contribute to the suppression measures of physical distancing, but by staying at home, we avoid exposure to the risk of the occupational disease COVID-19. We also reduce the risk posed to our families, where if you traveled in unsafe conditions, worked in unsafe conditions, you actually put your family at risk by becoming infected with COVID-19 disease and bringing it back into the home and into the community. So we should be very clear that the definition of the workplace and the responsibility of the employer to provide a safe workplace extends to traveling to and from work. More importantly, a lot of the measures taken by employers, because they see it as a public health risk somehow encroaching the workplace, their measures have been haphazard, their measures have been unilateral. It means they've imposed these measures, usually based on WHO recommendations or some part of that, but without engaging workers' representatives and trade unions. Like any occupational disease, employers must engage with trade union representatives and jointly work through how to reduce that risk and then to monitor and maintain that. So there's a very important role for trade unions in the implementation of those safety measures and in support for union members. And that's a very critical part of workers' rights, because with that oversight of the trade union and ensuring that the measures that are implemented are appropriate and suitable and that the workplace itself is safe, then workers are able to continue their work at this very difficult time. It's already hard enough. There's extreme hardship already in getting to and from work. There's a lot of anxiety and stress. We should then also add to that high risk of contracting COVID-19. This is very much a workplace risk. Now, one of the ways in which we reduce workplace risk is that workers are aware that they do have the right, again under Convention 155, of the International Labour Organization. They have the right that if workers feel that they face a significant risk to their life or to their health, and if the employer does not reduce that risk, then she can remove herself from that danger to protect her health and her life, remove herself from that danger without any risk of punishment or penalty, without a loss of pay and without being penalized. And this is a critical right of all workers in facing any kind of occupational disease or hazard. That is why we need to recognize COVID-19 as an occupational disease. Once we've recognized that, we also, by default, recognize the right for workers to remove themselves from danger if employers have not sufficiently addressed that risk. And this is a very important way in which we keep safe. It's also important to recognize COVID-19 as an occupational disease because then workplace compensation can be applied. It's tragic that workers who have become infected through their work with COVID-19 are unable to claim insurance, unable to claim medical costs, and in tragic circumstances where workers have died, their families have not been able to claim compensation as a work-related death. Now, this has to change because it's very clear that there's a very high risk of contracting COVID-19 as a disease in the workplace. There is exposure to the biological agent SARS-CoV-2. And therefore, if we recognize COVID-19 as an occupational disease, you also have the right to access that kind of medical care and compensation as any work-related disease. And that's very, very important because we really have to work through this crisis together and ensure that workers' rights and health are protected. Now, the final point I'd like to make is that another reason that COVID-19 needs to be recognized now as an occupational disease is because the pandemic will be over soon, inshallah, God willing, it will be over, but the disease will continue to exist. And therefore, we can't just remove all of these safety measures and go back to business as usual. That would simply create an environment in which there'd be another pandemic. What we need to do is slowly transition our way out of this COVID-19 pandemic. As governments lift their various kinds of lockdown measures, the fact is, in a workplace, employers will still be responsible to ensure that workers do not contract COVID-19 in the workplace. The only way to do that is to recognize the right of unions to engage with management in dealing with this as an occupational disease and to continue to have all the protection and respect for rights that's needed with dealing with a workplace health and safety issue. So I hope that's very clear. April 28 was very important in our push. We'll continue pushing that. And we must be very vigilant that when the pandemic over, it doesn't mean the risk is gone.